it's very common at Caring Medical for us to treat cartilage tears. They respond very well to prolotherapy. Most people forget, I mean, I've been treating cartilage tears for 20 years, so it's only been in the recent years, the whole stem cell thing for, say 12 years, 15 years. I mean, I treated cartilage tears just with like human growth hormone, dextrose, other simple solutions, and people got better. So the question is like, why would they get better when you didn't even use stem cells? Well, again, the cartilage was tearing because the joint was unstable. Okay, so I'm going to just use an example of a knee, right? All the cartilage does, the main thing the cartilage does is make a frictionless surface. Like that's really the main thing the cartilage does. All it does is make it glide good. So in other words, why would the cartilage tear? Like what's causing the tear? Well, imagine if you have a ligament injury and then all of a sudden, bam, bam, every time you run, bam, 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 then the thing tears. Then the thing tears. So in other words, the underlying cause of most cartilage tears is joint instability. So over the years, by me doing comprehensive Hackett-Hemwall prolotherapy, just with dextrose, getting all the ligaments tight, then all of a sudden when the person runs, they just glide good. Whether or not the tear completely healed, partially healed, all I know is the pain goes away and the athlete gets better and I don't see the athlete anymore. Like we do follow-up on our clients. Like we do follow-up. We don't see them. Why aren't you coming back? I'm fine. Like I'm running, I'm doing this. Every year I get all these letters about athletes. Hey doc, thanks, I finished the Ironman. Doc, I did a 30-mile race. Doc, all the time. All the time. Now there are going to be instances where it's not just a joint instability, but there's a big hole. There's not just a tear, there's literally a hole. So there are going to be times where, you do need to use stem cells. You are going to, where we do stem cells. So we get stem cells either from bone marrow or fat. And technically I should use the term progenitor cells. These are just cells that can form other cells. So from the bone marrow and from the fat, we get progenitor cells like stem cells, including stem cells, but there's other cells also that can form cartilage cells and other cells. So as it relates to, people are always like, well, does the cartilage tear heal and how does it heal? No, that's a great question. Like normally when we do repeat x-rays, the x-rays look better. When you do repeat MRIs, the MRI may or may not look better. But I say to the client, do you care? Like, I don't care. I don't care. I just want you to be able to do everything. Like, are we treating the MRI and the x-ray, or are we treating you? So you just got to realize that, like in other words, when tissues heal, whether they heal by surgery, like you have a surgeon that sews up a tear, but they won't. They don't really sew up cartilage tears because they don't stay. But let's just say theoretically the surgeon could. Afterwards, even after they sew it up, the density looks different on MRI. So in other words, whether you have a meniscal tear or cartilage tear, whether it's repaired by a suture or it's repaired by prolotherapy, the density looks different on MRI, so it never looks normal. So the only way you can tell whether it's healed or not is guess how? By how you feel. So if and you could ask surgeons this, they'll say that. It's by how the athlete feels. Can you run? Can you jump? Is your knee swelling? So if all that's gone, have a nice life. Like, don't worry about the MRI or the x-ray. So I try to, on the first visit, get the person out of the, I got to get my x-ray to better or my MRI. We got to get rid of that. All you care about is what? To meet your expectations, what do we need to happen? Doc, I just want to be able to run, run a marathon. I just want to be able to walk good. I want to go hiking. Okay, so let's make it our goal to have you go hiking. It'll take 4 or 5 visits. This is the solution we should use. So that's kind of how I handle it, I handle it. I don't worry about MRIs or x-rays. I mean, they do have their place, but I'm not treating an MRI or an x-ray. I'm treating a client.